Assalamu alaikum. I'm Dr. Abdul Latif Shahid, Head of Department Pediatric Orthopedic Surgery, the Children's Hospital and University of Child Health Sciences, Lahore. Today, I'm going to discuss about physical examination in DDH. There are prerequisites of physical examination. These are: child should be relaxed, examiner should also be relaxed, room environment should be comfortable, examination surface should be firm, and all these things should be in mind, and then perform physical examination in a newborn child. As already discussed, every child should be examined within 72 hours of his or her birth. This physical examination, two basic tests, Barlow test and Artolani test. These tests are similar to liver palpation. We can feel the movement of head out of acetabulum or within acetabulum. Barlow and Artolani tests are two basic tests that are performed at birth. One thing should be keep in mind that at one time one hip is examined and then other hip is examined. In Barlow test, both hips are flexed, both knees are flexed. Examiner placed his or her hands on greater troch, adduct the hips and push the femoral head posteriorly. If head is dislocated, then it is positive sign. Barlow test is positive. For remembrance, B for Bahar, head is pushed outside the acetabulum. While in Ortolani test, it is reverse of Barlow test. Head is dislocated, abduct the hip joint and reduce the femoral head, which is already dislocated. If femoral head is reduced, it means Ortolani test is positive. For remembrance, O for out, head is out, and you have to locate it. So these are two basic tests which are performed at birth. Also, in older child, there are some physical signs and then two other tests. Abduction is limited, thigh skin folds are abnormal. These are two physical signs in older child. While there are two tests, one is Galeazzi test. It is performed for unilateral cases to confirm the LLD, while in bilateral cases, shortening is confirmed by Galeazzi test. In Galeazzi test, both hips joints are flexed, both knees are flexed, both feet are come together. See the level of knees in Galeazzi test. Both knees are at not same level. In Klissic test, keep index finger on anterior phalanx spine while middle finger on greater trach. Draw a line which connects these two fingers and then extend it proximally. In normal cases, it will touch the umbilicus, while in dislocated cases, this line is below the umbilicus. So, in unilateral cases, to confirm the shortening, Galeazzi test is performed, while in bilateral cases, to confirm the shortening, Gleason test is performed. In walking child, in case of unilateral cases, Trendelenburg gait is present, while in bilateral cases, gait is waddling and also patient is hyperlordotic. There is hyperlordosis at lumbar region. The reason is there is flexion contracture on both hips due to DDH. So, in a nutshell, physical examination is different at different ages. At birth, there are two basic tests. One is Barlow and other is Ortolani. In older child, abduction is limited, thigh skin folds are abnormal. In unilateral cases, Gleason test positive. In bilateral cases, Gleason test is positive. And in walking child, in case of unilateral, Trendelenburg gait is positive, and in case of bilateral, waddling gait is positive, and hyperlordosis is present.